organizers of this particular webinar a very appropriate and very timely topic, because as Sonu has already said, we are thinking in tobacco control these days a lot about multi-sectoral involvement. We also know, I mean, we have experienced, those working in tobacco control, that it is much more difficult, much than saying it, much to get involvement of others. Most people or most department people working in other areas do not think that they have much to do with tobacco control. But as has already been said, these sustainable development goals are have been put forward and accepted by the United Nations. So all the nations have accepted and endorsed them. Now, so it depends on us, all of us in tobacco control, that if we project the advancement in tobacco control as a way of attaining a sustainable development goal in every area. Everybody is interested. Everybody who is working in development or in the government is interested in certain areas of development and reaching targets in SDG. If we in tobacco control can point out, can precisely show that by advancing tobacco control in this way, we all will be progressing towards achieving the targets in sustainable development goal, that will go a great way in multi-sectoral involvement, as well as real advancement in tobacco control. We understand, I think we have debated it, we have seen many conferences, webinars detailing on the points that how tobacco control affects and requires inputs from every sector. And it's not just health. Health is, of course, the prime and the most important reason for which we are really working on tobacco control. But the field is so vast that only by health consideration, we cannot achieve a great deal in tobacco control. We have to take a lot of others into our fold, into the fold of tobacco control to progress. So I am sure this particular webinar will take us much farther in that direction. And therefore, I very much welcome organization of this seminar. And I really look forward also to listening to everybody's views of how we all should take tobacco control forward in reference to attaining the targets of sustainable development goals. So thank you all very much, and thank you, Sonu. And I go back to Rajiv, please.
So thank you, sir. Again, I wish to thank you for being present. And I think 25, 30 years back, when we used to look at tobacco control, so we could see only 2 or 3 people who are working in tobacco control. And sir, you are one of the legendary who had started tobacco control movement in the country. So, and your presence in this consultation, so I think holds much meaning. And thank you again for supporting in this consultation as well, sir. Thank you. Over to Rajiv.
Thank you, sir. Thank you for sharing your ideas. So now we have with us Dr. Jadeesh Kormam, Regional Advisor, Tobacco Free Initiative, WHO CRO. So our next guest of honor. So I request ma'am to share her view regarding the today's webinar. Over to you, ma'am.
Good morning, everybody, and namaskar. And thanks, Rajiv, for your generous introduction. And first of all, like my previous predecessors and senior colleagues said that, thanks to the organizers for picking up this topic and bringing it on board, because most of the times we don't talk about it. So this is a very important topic, because tobacco itself is a very large or big risk factor for non-communicable diseases, where all over the globe countries are struggling to meet the targets, and NCDs, because now they account for 70 to 80% of mortality everywhere. So we have to be very serious about that, because most of the countries are still, they are struggling with other health issues. So now coming back to SDGs, because see, it's always there, having the targets. So we had health for all by 2000, so we missed that. Then came the MDGs for the next 15 years, we missed that. Then, a lot of deliberations, at the UN level, and now 193 countries striving to meet the SDGs by 2030. But now we are in 2021 and we have very less time. On top of that, COVID-19 pandemic has pushed back everything, right from the economy to other sectors. So it is very, very difficult that countries will be achieving these SDGs. In my region, Southeast Asia, earlier, even the tobacco control targets, this NCD action plan targets 2025, we are not able to meet. And now SDGs, reduction of the NCD mortality, that will be missed. And because tobacco control is related to so many other SDGs, so we are, kind of lagging behind. And that is why focus on SDG 3A, accelerating WHO FCTC, that remains with us. So countries have to push on this agenda, SDG 3A, because others lie outside the health sector. So whatever is within our means, whatever is within the means of health sector, and then enhanced coordination and collaboration with sectors outside the health, enhanced participations with all the networks who are working for tobacco control and NCDs. I mean, kind of whole of government, all of society. So we don't have just to talk about these things, we have to implement these things. And unless and until everybody comes together, we won't be able to achieve these targets. We will be, lagging behind. We will be kind of, having more targets. Then, after 2030, there will be something else. But then it is time that, the sectors come together and then push for these important things, because SDGs concern everybody. And, the entire global, not only health, economy, so many other things, they depend upon these. And we really need to be focused when we talk about, SDGs, and when we talk about just not giving this commitment for the sake of it. We need to be very serious about it. For example, I'll just give an example of climate change, environment, how we are suffering, how the entire world is suffering, because we just think that it is somebody else's business. It doesn't concern me, but every single person has a role there. And unless and until, we are serious about that, what's the kind of earth we'll be handing over to the next generation? So these issues are really, really serious, and we should not just be leaving this to the governments, like government has to do this, No, it is everybody's business. So now, we have to realize each and every person. Then only, these targets will be achieved, and there will be some commitment, some diligence, some, seriousness. Thank you so much for the opportunity. Over to you.
So thank you, Madam Jadeesh Kaur. I think most of people here know about Dr. Jagdish, but just to reiterate, Madam Jadeesh Kaur is looking after this tobacco control section, basically in the Southeast Asia region of the WHO. So she is the nodal person, focal person of Tobacco Free Initiative, and she has been in tobacco control first in ministry and now in WHO for quite some time. And she has always been a support for all of us in tobacco control fraternity. So thank you, ma'am. Thank you for being present and talking about very important topic about whole government approach, because now we should look after this and everybody's business, very rightly said, because we should not leave everything to just the government. So we need to do something on it. And you gave very good example about climate change. Again, tobacco control can also lead to a better climate, poverty. So tobacco control, if we do, it can lead many people away from the impoverishment. So I think very well said. So thank you for initiating these thoughts, which we will discuss in detail during our future sessions. Thank you, ma'am. So over to Raju.
Thank you, ma'am. Thank you, ma'am. for sharing your ideas. So now we have with us our next guest of honor, Dr. Rana J. Singh sir. Dr. Rana J. Singh sir is a Deputy Regional Director, NCD Tobacco Control, the Union Office. So I request sir to share, to address the audience, please.
So Rajiv, thank you. Can you hear me?
Yes, sir. Yes, sir.
Okay, okay. Thank you very much. So, dear Professor Goel, Director RCTC, Dr. Meeraji, Dr. PC Gupta ji, Dr. Kaur, all the keynote speakers, panelists and participants. I won't be speaking too long, except to say that it is not too late to start a discussion on role of tobacco control to achieve sustainable development goals. What is important for us to understand? When on September 25th, 2015, United Nations formally adopted implementation of FCTC as an important goal to achieve sustainable development goals, which is a plan to eradicate global poverty. So at that time, they made it very clear, United Nations made it very clear that sustainable development goals, they formally recognize the negative impact of tobacco consumption on health, wealth, and development. UN wanted all the member countries to commit to combat the ongoing tobacco epidemic, especially through implementation of WHO FCTC, Framework Convention on Tobacco Control. You also know that the FCTC's first global health treaty, with its objective to protect present and future generations from devastating health, social, environmental, and economic consequences of tobacco consumption and exposure to tobacco smoke. So I think Dr. Goel has already informed us. So now what we need to do, how many countries globally and really in our region has really started effectively on this goal? First, it is goal 3, that is health. Then within that goal, tobacco control, that is implementation of FCTC to achieve goal 3 of sustainable development goals. So how many countries have really started? How many countries, or within our own country, how the states are going to review the progress of implementation of FCTC and WHO Empower and National Tobacco Control Program. So I hope that the speakers will focus on all the related issues. Overall, we hope that sustainable development goals will raise the profile of FCTC and provide desperately needed resources, especially for poor and low and middle income countries. As you know that the burden has already shifted from developed countries to the developing countries. So this is very important for us to understand. We also recognize that tobacco use is the most important risk factor for non-communicable diseases. So those recognitions now they are already there. So overall, what do we need to do? You see, already if UN has already included tobacco control as one of or FCTC implementation as one of these strategies to achieve goal 3 and overall SDGs, work is not done. We continue to make efforts at that level also, at UN level, at country level, national level, or at sub-national level, that will further to in the integration of tobacco control in sustainable development goals. In every goals, I think 7 or 8 goals are directly related to achievement to tobacco control. How much we achieve in tobacco control, they are very important to address those other goals also. We need to ensure to highlight that tobacco epidemic as a development priority. So that is a few thoughts. Once again, thanks to all the panelists, chairs, speakers, Dr. Goel and team. Thanks. Over to you, Rajiv.
So thank you, sir. I think again, like I told about Dr. Meera Agi and Dr. PC Gupta, Dr. Jadeesh Kaur. So Dr. Rana is I think those who are in tobacco control are, I think I think that nobody might not be knowing about him. So he has been a crusader in tobacco control. I think he has been doing excellent work, licensing and multi-stakeholder engagement. And he has been one of those who has been pitching this idea of tobacco control and SDG. So I remember some time back, we hold a training in which he took a session. It was a management training, and he took a session on sustainable development goals, and he took the examples of tobacco control into that training for a management training for people from outside country. So I think he has been a strong pitcher for this sustainable development goals. And as he has rightly said, that we should not only focus on just one agenda like 3A, but also we should pitch for other agenda. As a public health professional, we should also pitch for other sustainable development goals as well. So thank you, sir. Thank you for being present. So over to Rajiv.
Thank you, sir. Thank you, Dr. Rana, sir, for giving guidance all the time. Thank you. So moving ahead, before announcing that winners, one announcement to all the participants. So we will providing the participation certificate at the end. You need to stay with us till the whole sessions, and after the later part, we will provide you the feedback form. You need to fill the feedback form as well for having the certificate of this particular webinar. So I request Dr. Sono sir again to facilitate this announcement of the winner of photography competition we have undertaken under the campaign of NCTUH.
Right. Thank you, Rajiv. So I think for last now 8 months, we have been holding various competitions under the realm of National Conference on Tobacco or Health. So we hold like short film competition, we hold poster competition, skit competition. So we held various competitions under this National Conference on Tobacco or Health. And this time we held a competition called as photography competition. So what the participant need to do is, so they need to click a photograph which depicts the message on different themes which we have shared with them. So it was a unique competition. It was not a drawing. It was not something. They just need to click a beautiful image which depicts, and they need to write about that image, that what it shows. So it is a live photograph which they need to do. So we had received quite a good number of entries there. And I think we had some competitions among the winner as well when we were deciding upon that. So we announced 3 winners, and these 3 winners will be given a goodies from our National Conference on Tobacco or Health Secretariat, as we have given the prizes to the earlier winner as well. And they will be another, like there will be free registration for them and some other prizes for them as well. So I would like Rajiv, can you announce the winners, and can we show the photographs? Have we got their photographs?
Yes, sir. Yes, sir.
Okay. So I think these are some of the things which were selected out of I think 67 or 68 entries. How many?
67, yes, sir.
67 entries. Yeah, 67 entries. We have selected these 3. And I think I don't remember right now what they have written under these themes, but these are the 3 photographs which were selected. And I think you can see on the left hand side, I think मैं स्टाइल में रहता हूं और अभी स्टाइल में मरूंगा. So this is I think the quote, a person who is, I think, a lay person who is sitting on his vegetable basket. And so it is about, it is the theme actually, what it wanted to depict is that they just drink, they just have this smoking in style, for style, or for showing something that I am doing some. So then the second prize goes to that the image on the right hand side, and you can see that she's a pregnant female. You can see the pregnant female and smoking. So you can see, I think, making or making an unbreathable for a newborn before it actually break, something of that sort. So basically what it tried to show that even those pregnant ladies was smoking. And again, I think this is a very bad things to be done. And again, I think this is on the positive side, the third image by Miss Neha Khandelwal, and they want to show that how tobacco, if tobacco is not there, so how it kills. And you can see the tobacco buds, life, basically this plants depicts life, and the tobacco buds depicts death. So the tobacco buds are lying in the plant itself. So I think these are the three images which were selected by our team. So congratulations. And these are the two appreciation prizes. You can see the Ms. Tejinder Kaur and Ms. Shikha Sharma. So these are our appreciation prizes. So congratulations for those who have submitted their photographs, and congratulations for the winners. Over to Rajiv.
Thank you, sir. Thank you for announcing these winners of competition. So now we going forward to our technical session of this webinar. So we have with us for first keynote speaker, Dr. Sunila Garg ma'am. So Dr. Sunila Garg ma'am is a director, professor, head and Department of Community Medicine, Maulana Azad Medical College, New Delhi. She is head of faculty, medical science, with the demonstrated history of working in medical education, public health management. She has a strong education professional skill in epidemiology, program evaluations, global health, healthcare management. And besides this, she is also advisor of ICMR, DBT, and on expert committee of WHO. So I request Dr. Sunila Garg ma'am to share their PPT on introduction to SDGs. SDGs relevant to tobacco controls. Yes, ma'am. Over to you, ma'am.
Can you all see this presentation?
Yes, ma'am. Screen is visual.
Okay. So I'm going to talk about, the tobacco control and the sustainable development goals. Can you all hear me properly?
Yes, ma'am.
Yeah. So all of you, I first of all, thank you, Rajiv, for having me over here, and Dr. Sono for giving a wonderful introduction and thinking about this program. And I listened to Dr. Meera, Dr. PC Gupta, Dr. Jadeesh Kormam, Dr. Rana, and the beautiful poster competition that shows it is ingrained in the mind of the students that basically we do not have time, and we need to kind of focus on tobacco control, because if we have to end poverty, goal number 1, or if we have to have zero hunger, good health and well-being, if we want to provide quality education to our children, or if we want to have gender equality, if we want to have clean water and sanitation, or affordable clean energy, decent work and economic growth, industry innovation and infrastructure, and we have to reduce inequalities, and we have to have sustainable developments in communities, or we have to have responsible consumption and production, climate action, what Dr. Jagdish mentioned, we need to have aquatic life also, we have to have life on land, we have to provide peace, justice, and strong institutions and partnerships for goals. For these 17 development goals, somewhere or the other, you will feel that basically, if we focus on tobacco control, that is going to, address our, sustainable development goals in a big way. So now, basically, as was mentioned earlier also, that by Dr. Gupta and others also, that and Dr. Meera also, that, we stopped looking at, we rather moved on from Millennium Development Goals and tobacco control to sustainable development goals, because ultimately we have to see that, our efforts are continuous, they are sustainable, and we have to continuously go on addressing, the issue of poverty or hunger or our health or quality education. These are lifelong learnings and lifelong processes, and including partnerships for goals. Now, where are SDGs? Sustainable Development Goals, as has been pointed out by Dr. Rana also, they are a United Nations initiative formally adopted by United Nations General Assembly on 25th September 2025 in a resolution which was entitled Transforming Our World. We have to transform the world. As I named all the 17, Sustainable Development Goals, the 2030 Agenda for Sustainable Development. So that is one thing which is very important. And they have, as I've already mentioned, that they have succeeded the Millennium Development Goals. They include 17 goals, which I already discussed, 169 targets, divided under these 17 goals over next 15 years with the aim to end poverty. We have to protect the planet. We have to ensure prosperity for all as part of new sustainable development agendas. And another thing was that to whom do they apply? Sustainable Development Goals apply to all countries. They apply to rich and poor, and recognize a crucial interrelationship of health, poverty, education, gender, and many other issues. Because, if there's poverty, you will not have access to good health. If you're having poverty, you will not have access to education. If there are gender disparities, that will also lead to, compromising on education, compromising on healthcare seeking, and also will, accelerate our poverty to many-fold times. Which goals are basically relevant to tobacco control? Now, reducing tobacco use plays a major role in global efforts to achieve Sustainable Development Goals to reduce premature deaths from non-communicable diseases by 1/3 by 2030. Now, many of the 17 goals have a direct or indirect relationship to tobacco control. But the most immediately relevant are the following. Number one, that end poverty in all its forms everywhere. That is number one, as has been shown below, that there has to be no poverty. So that tobacco is directly related to poverty. The consumption of tobacco pushes many families below the poverty line, whether it is in the smoked form or it is in the non-smoked form. Then goal 3, ensure healthy lives and promote well-being for all ages. And if we are, promoting, or if there is increased consumption of tobacco, we'll see NCDs, we'll see, a pregnant woman ending up, there was a beautiful poster, but then, in my heart, I felt little, kind of, touched that poor baby, for no reason he or she may be affected by in terms of preterm baby or a low birth weight baby. Now, goal number 5 talks about achieving gender equality and empower all women and girls. And rather, we have to make sure that, this knowledge reaches equally to all, basically women and girls also across all the continents of the world. We have to reduce inequality within and among countries. Then goal number 12 talks about sustainable production and consumption patterns. And we have to strengthen through goal 17 the means of implementation and revitalize global partnership for sustainable development. And then we have to see that basically when we talk about that, we have to talk about the no poverty. So it is well documented that, tobacco contributes to increasing poverty, and particularly in developing countries, and tobacco companies continuously target disadvantaged low and middle income countries and communities, thereby increasing the health disparities. And you can see that over a period of time, it is the smokeless tobacco, which has taken, the upper this thing as compared to the smoked form of tobacco. But then, this is a hidden pandemic, I'll say, kind of, which is, affecting the world across. And we have to see that these are the major companies also. And under the garb of these major companies, somewhere or the other, we have to look at that. We have to see that we are not caught unnecessarily, and we have to look at ending all forms of poverty everywhere across the world. And approximately, we know that 80% of the world's smokers are in the low and middle income countries, where the burden of mortality and morbidity caused by smoking is increasingly felt. And economies and health systems of low and middle income countries will be adversely affected in the absence of effective tobacco control action. And you can see in India, we have, basically hardened smokers are to the tune of 26.36%. So this is only, I'm talking of hardened smokers in terms of, and these are in terms of millions. So somewhere about, when we talk about, it is about 27 million. And this is, and here another country which has got equally this thing is about China. And then we do have after this Russia as well. But then we have to, when we look at India, it is an alarming figure which we need to be, concerned when we are talking in context of no poverty. Now, a recent report which was published by National Cancer Institute of USA and WHO entitled, Economics of Tobacco and Tobacco Control concludes the following. Number one is that tobacco control reduces the disproportionate burden that tobacco use imposes on the poor. So that is one thing which is important. It reduces, if you are looking at reduction, it will reduce the disproportionate burden. But then if you are increasing the tobacco use, basically, that is going to, impose lot of, it pushes many families below the poverty line. But if we are looking at tobacco control, we will ease the families, and we'll bring out of, there are many families out of the poverty line. And tobacco, both in smoking and smokeless form, use is concentrated amongst the poor and other vulnerable groups like children and women. And tobacco use accounts for significant share of health disparities between rich and poor. That is one thing which is very important. In a recent study which we conducted, children as young as, about 11 to 12 years are indulging, basically in smokeless tobacco consumption, though within the institutions the smoked form of tobacco has gone down. But ultimately what we have to see in northeastern region, even very, very young girls, they indulge into the smokeless form of tobacco use, which poses a lot of burden on their health as well. So there is a lot of inequality, and we have to together end poverty, as has been mentioned over here. So this is one thing which we have to keep in mind. So if we look at the relationship between tobacco and poverty, the family falls into poverty. There is increased vulnerability to tobacco use because they think that we are disturbed, we are anxious, we have to, take care of, because of anxiety, they, fall prey to the consumption of smoked and smokeless form of tobacco. There is high prevalence and consumption level. Then there is foregone income. Number one, that is that your income foregoes, into use of tobacco. And there is high opportunity cost and less money spent on education and nutrition. Remember, there is finite amount of money within the family. And from that finite amount of money, if half of the money goes for tobacco or 1/3 of money goes for tobacco, now where is the money to eat balanced diet? Where is the money to send children to good schools? What about, when we are talking of other, issues of development, there is no money for that. And the breadwinner gets sick due to tobacco use. And then foregone income too is that, because of, number one is that we are not able to spend on good things. Number two is that, basically due to treatment, lot of money again is, which is impinging on the family. There is loss of work days. And then due to premature death, that is foregone income 3, again, family falls into poverty. So there is a vicious circle of tobacco and poverty which continues. So these disparities between rich and poor, they already are, increased by lack of access to healthcare. So, gradually what we see is that, if you can see that there is a poor family over here and there is a cycle of tobacco use and poverty, that this is poor family members, they use tobacco, and then, money spent, on tobacco instead of food and all that. And you can see that the children are also falling prey to this. And then, basically there's cost of treatment, and ultimately this is what is a figure which I don't like to show, but unfortunately this is the hard fact. And you can see that, this is the kind of healthcare seeking. And then there is diversion from household spending from other basic needs, which I've already told you, such as food and shelter, to tobacco use. And it contributes to poverty, illnesses and all, which leads to, again, increased healthcare spending. Now in India, 35 to 69 years of population spends about 1.48 trillion, that is US dollars 22.4 billion on tobacco related diseases. Now $1 is approximately about 76 rupees on tobacco related issues, and with 16% of this expenditure going to direct medical costs and 84% going to indirect morbidity costs. So thus it is evident that tobacco related diseases have enormous economic and health consequences within the developing countries. So this is where, if we have to end poverty, if we talk of no poverty, this is where you can see the scenarios also, across. People are also buying smokeless tobacco apart from this, but the need of the hour is that we divert this, under tobacco control program, we focus on prevention and control of tobacco use, then only we can end poverty. Now, if we look at tobacco control interventions to help target achievement, we have to have multi-sectoral approach where the government and non-governmental organizations and other stakeholders have got an important role to play. Then prevention and control of tobacco use through WHO FCTC. As has been pointed out by Dr. Rana, how many countries have implemented this in full form? Then another thing is that we have to increase awareness on harmful effects and depth of tobacco use via IEC information, education and communication material. A lot of you prepared beautiful posters, counseling sessions, street plays and all that. So this is how you can see the educational program, and we have to see end to, smoked and as well as smokeless form of tobacco. Now, ensuring the well-being, if we are talking of, and promote, we have to look at, basically good health, and we have to promote well-being of the individual, which is, everybody made a mention of goal 3 under sustainable development goals. So this is where important role of FCTC comes into picture. So key target for goal 3 is to strengthen the implementation of WHO's framework of Convention of Tobacco Control. It is not only mere implementation. When we talk to different countries, like when we talk to Southeast Asian region countries, they have this, but then implementation is not there in full form because nobody is there to evaluate also. So this is where, when we talk of Framework Convention of Tobacco Control in all countries, as appropriate, we have to strengthen, according to the country's needs. So the inclusion of tobacco control and WHO FCTC implementation as a key target recognizes the magnitude of smoking epidemic. So this is one thing which under this framework of Convention of Tobacco Control, there are a lot of things, if it is implemented in true spirit and monitored in true spirit, that is where, because this is the only framework under tobacco control for, from WHO's perspective, this is available. So for no other disease, you will see that there is framework of convention of control for that particular disease from WHO side. So this is one thing. So that means you can understand a strong commitment from the perspective of UN organizations, from the perspective of, developed and developing nations. So this is one thing which we must keep in mind. So in Southeast Asian regions, I'm talking of not Indian region, I'm talking of whole Southeast Asian region, maternal mortality rate is 164, basically per 100,000 live births. Denominator is live births. When we talk of maternal mortality rate, actually it is a ratio because, the numerator 164 is the death and we are dividing it by 100,000 live births. Now, smoking also leads to ectopic pregnancies, preterm labors, spontaneous abortions and pregnancy loss, increasing the risk to the lives of pregnant women. So this is where, again, from the gender perspective, from the smoking perspective, this becomes very, very important. And from the good health, again, this is one of the very important agenda. Now, another thing is that Southeast Asian region accounts for 45.6% of global burden in terms of TB incidence, and nearly basically there are 3.5 million persons who are living with HIV/AIDS in Southeast Asian region, the second highest burden after, sub-Saharan Africa. So tobacco is one of the commonest, preventable cause of death, particularly when we are talking of these diseases. If we see the, tobacco and TB correlation, that is really a combination, this is really a deadly combination. And I'll say that many of my postgraduates who have worked on smoking and TB, they found that there is more, the TB persons, they progress much faster. The cure rate is lesser and they rather, progress faster towards the worsening of the disease despite taking the treatment. That is one thing which is very, very important. And you have to see that, again, when we talk of other part of the things like NCDs, tobacco is one of the common preventable causes of death and a major risk factor for non-communicable diseases. As you will see, when whatever non-communicable diseases you study, when you talk of hypertension, you talk of cardiovascular disease, you talk of stroke, you talk of diabetes, you talk of chronic respiratory diseases, under which, everywhere, you can see that the doctor who is examining an individual, probably a case of tuberculosis, see the picture of malnutrition, which really bothers you somewhere, and this is where you can see the picture of cardiovascular diseases, and this will ultimately lead to myocardial infarction and all that, or when we talk of stroke and all that. So these are some of the important things which we need to keep in mind. So tobacco is a gateway for substance abuse also. Nicotine contained in tobacco is one of the highly addictive substances, and secondhand smoke exposure adversely affects the reproductive system, which I already told you, and its development and function at every stage of life. So it causes hormonal imbalance amongst women, which is leading to infertility. So you have to keep that in mind as well. Now, another thing which was pointed out by Dr. Jagdish was also that even, and Dr. P.C. Gupta also, that when we talk of pollution also, whether we talk of air pollution, soil pollution, tobacco is one of the important factors, as you can see over here. And if you can imagine that people smoke in billions across the world, in terms of number of cigarettes, or when they throw these butts down, or when we talk of smokeless tobacco, particularly in COVID times, we realize that, people just eat smokeless form of tobacco and they just spit it on this thing. So, that is another cause of spread of, SARS-CoV-2. So air pollution is one of the biggest environmental risk to health and must be addressed on a priority basis as it continues to rise, causing long-lasting disease and illnesses in addition to causing nearly 8 deaths every year in the Southeast Asian region. Now, tobacco growing also leads to soil and water pollution in addition to indiscriminate throwing of these butts and all that. And but if you have to grow tobacco, you have to use large amount of chemical fertilizers, insecticides, pesticides, which again leach into the groundwater and leading again to soil and water pollution as well. So these are some of the important things which you have to keep in mind in terms of air and soil pollution as well. So as again, you can see that, this is couch potato syndrome, and you can see that tobacco use is causing cancer. There is no organ which is not affected by, tobacco, whether we talk right from, mouth and throat to esophagus to voice box, or we talk about leukemias, or we talk of kidney problems and all that, cancers of pancreas or stomach and all that. Everywhere you'll find that tobacco is a root cause, if it is, taken basically, and its use is not controlled. So behind every cancer, you can always find in majority of the cases, the intake of tobacco. So as you see, NCD Alliance, Non-Communicable Disease Alliance, is pointing out that almost 2/3 of non-communicable disease deaths, which I already mentioned, whether it is hypertension, cardiovascular disease, diabetes, stroke, and are linked to tobacco, alcohol, unhealthy diets, and physical inactivity. Because you see, once you will take tobacco, along with that, consumption of alcohol is quite common. Then we have got the culture of, pizzas, burgers, and all that, which is leading to a body like this, and physical inactivity. So the cost of inaction on non-communicable diseases far outweighs the cost of action. So if we have to see the cost of action means we have to control tobacco. WHO sets out specific tobacco-related target of a 30% relative reduction in prevalence of current tobacco use by 2025. The ambitious but vital target is key to achieving the broader NCD target, which is related to Sustainable Development Goal 3. Now, Indian health target aims to reduce tobacco use by 15% by 2020 and by 30% by 2025. Before reaching the age of 70 years, every 1 in 4 Indian has a risk of death due to non-communicable diseases, and behind which is an underlying cause, that is tobacco consumption in smoked or smokeless form. So this is one thing which is important. So we have to look at our targets, and we have to see that basically we have to look at the relative reduction in terms of consumption of tobacco use. Rather, we should be very proactive, particularly, with regard to these symposiums and seminars and all that. Our objective is that our behavior change has to come through these awareness sessions, and we together need to act, if we have to bring about a change. Now, substantial increase in health financing is also required for recruitment, development, training, and retention of health workforce in developing countries, especially in least developed countries and small island developing states, if we have to focus on control of tobacco. Now, basic key to prevention and control of tobacco is that we have to strengthen the capacity building of all the countries, and we have to implement the framework for Convention of Tobacco Control. We have to train people. We have to bring awareness amongst people regarding, NCDs, or when we talk of poverty or we talk of other things. Basically, for that, capacity building is required. And basically, capacity building also has to focus on early warning, risk reduction, and management of national and international global risks if we are going for, if we have to talk about tobacco consumption. Now, basically, if we have to talk of, some of the tobacco control interventions and SDG 3 target achievements, offering tobacco cessation services, especially brief advice, that means to quit, to pregnant women using tobacco, and awareness generation on harmful effects of secondhand smoke on unborn baby, that is already there in Article 12 and 14 of WHO FCTC. So this is where we have to be very, very proactive and take action, with regard to, and create awareness with regard to this particular Article 12 and 14 of WHO Framework Convention of Tobacco Control. Another thing is that we have to coordinate national TB and HIV/AIDS program with tobacco control programs as well, giving them equal importance, and at many times we can integrate also. And we can integrate tobacco prevention and control with NCD action plans and monitor their planning and implementation also. So wherever we talk of NCD, wherever we talk of TB, whether we talk of HIV and TB also, we have to talk of prevention and control of tobacco as well. Now, effective implementation of Article 18 of WHO FCTC addresses concerns regarding serious risk posed by tobacco growing to human health and environment. As I told you, that which will lead to, basically immense amount of soil pollution as well. But then this is also harmful to human health and environment as well. So this is where, and you can see a small baby, for no rhyme or reason, you see, we are, affecting her health. So she becomes an indirect victim to, smoking, and that is where we have to pay a lot of attention to tobacco cessation as well. So if we have to empower, basically, if we look at, goal number 5, and we have to have the gender equality and empower all women and girls. Historically, we have seen, earlier we used to see in developed countries that in Europe and elsewhere, smoking was higher amongst men than women. But then over a period of time, the trends changed dramatically across Europe. The smoking has been increasing amongst women, and particularly among young women and girls. And this is not a uncommon phenomenon in Indian context also. You will see a lot of, so-called pseudo-fashionable girls or pseudo-fashionable women, and the poster also got that prize also. Basically, this is where is not an uncommon scenario in Indian settings. In addition to the harm of smoking, which is well documented over years, we have already told you that, they are at risk because of them, they being at risk and their unborn children. And they also are there at risk from the harm of secondhand smoking. Even if they do not smoke, their partners are smoking, or adolescents in the family are smoking, they become indirect victims of the smoke as well. So tobacco industry marketing has targeted women heavily. This is one thing which we have to keep in mind. And when we are targeting a tobacco industry, we have to look from the gender perspective as well. And particularly they are targeting, women and girls and younger women, because they are an easy target. Marketing targeted to women and girls include both direct and indirect advertisement and promotion through all media, including social media, through which our young people, they fall a easy prey through these social media networks. And some other means of advertisement, such as pack and product development and design and flavoring, association with desirable behavior. So this is one thing with the how you see the companies are going to target the women or young girls also through, their attractive means of flavors and, the designing and all that. So this is where, when we are aiming at tobacco control, we have to see that there has got to be plain packing, there has got to be no flavoring and all that. So this is one thing which is very, very important also. Now, again, women are...
Ma'am, can you summarize, ma'am?
Okay. Yeah. So then this is, basically about, we have to look at the, women are also involved in, farming and all that. So we have to look at from that perspective also. And many education programs have focused on males, not on women. So it is important to look from that part also. So if we have to look at, looking at that part, we have to regulate flavors, we have to look at graphic health warnings, we have to ban on tobacco advertisement and awareness generation. That is important. Then also we have to see that we have to reduce inequalities amongst the countries also, as we are all aware of that basically there is a lot of disparity, and tobacco industry has got a multi-country presence. So tobacco use increases inequalities by making multi-billion-dollar tobacco industry richer at the expense of health of tobacco users who get pushed into poverty. So this is one thing which is very, very important. So we have to specially focus on all the government programs related to tobacco control, and tobacco control should assist and support disadvantaged group and reduce the contribution of smoking to health and social inequities. So we have to see that we have to have equality and equity as well. So government programs should also counter the continuous effect of tobacco companies to target vulnerable population. And also, if we talk of Sustainable Development Goal 10, we have to eliminate cross-border illicit trade of tobacco, as is mentioned in Article 15 of WHO FCTC, and we have to prevent control of tobacco use through WHO FCTC also. And another thing is also that we have to have the responsible consumption and production patterns. So that is where it is important that evidence of circumstances are very less. So that is where under which tobacco production and promotion can be seen as responsible. So we need much more evidence with regard to responsible consumption and production also. But the recent evidence is showing that high proportion of smokers are likely to die because of their smoking in countries with mature epidemics. So these are some of the very important things. Additionally, we have to see from the farmer's perspective, and child labor also is very common, particularly when we talk of in terms of tobacco farming also. So all programs should be need to see they need to be seen from the perspective of sustainable development goals. And basically, we have to see that, parties shall act to protect these policies from commercial and other vested interests of tobacco industries in accordance with national law, while setting and implementing their public health policies with respect to tobacco control. And then also we have to focus on global partnerships, basically, in order to prevent the tobacco control, because, tobacco control has got a very strong history of cooperation. And that is where we need to focus on partnerships between different countries, whether the developed and developed ones have to come together. And the governments have got to play a critical role in implementing sustainable development goals. And another important part is that not only governments, it's very important from the non-governmental organizations also. And then another thing is that for India, we have got a national tobacco control law is the cigarette and other tobacco control products, that is prohibition of advertisement and regulation in form of POTPA Act. So that is where we need to facilitate this POTPA Act in true spirit, and then we have to see that that is implemented if we have to focus on sustainable development goals also. And with this, you are already aware of that we have to prohibit smoking, we have to have, outdoors, open spaces and all that, prohibit, tobacco advertisement, promotion and sales and all of that. So that is important part. And then we have to remove the, our pictorial warnings, have got to be, so much like that so that people can understand. So these are some of the pictures of, capacity building that by district collectors, and all that. This is where the need of the hour is, that people should come forward and train people. And tobacco-free Sri Kedarnath Yatra was there by district magistrate of Rudraprayag, Uttarakhand. Then training workshop for law enforcers under tobacco vendor licensing. Okay. So this is where is this, and this is now recently the GYTS report has been released, and it shows, basically the tobacco consumption has gone down in boys and girls also, which is a good sign, but we need to bring it down to zero. So ultimately, what we have to see that we have to overall increase the tobacco, taxation also, we have to adopt, all form of strategies to address the sustainable development goals, and we have to be the vision of change what you want to see in the world. Thank you so much. I've crossed a little bit of time, but then that's where it is. Thank you so much. Thank you.
Thank you, ma'am. Thank you, I think, for summarizing the entire SDG. I know that it took more time, but I think it was fruitful for some people who are youngsters and who are in public health and tobacco control, want to understand the similarities, like how we can achieve tobacco control, how we can achieve SDG through working on tobacco control, and what are the broader vision which we need to see. So thank you, ma'am. Thank you, I think, for summarizing the entire topic quite well. So I think it will be good for our panelists also when they will be speaking. So I think most of the things you have already covered. So now I request our all the participants and the speakers who can switch on their videos. So before the plenary session, we'll have a group photograph, and then we'll have a plenary session. So maybe everybody can switch on their videos. In the meantime, people are switching on their videos. I think I can see Dr. Swasti as well. So welcome, Dr. Swasti. So I can see Dr. Ashok, Professor Ashok Bhardwaj as well. So namaskar, sir. So I think, yes. So because tobacco is linked with TB, sir, and you are the national president for the tuberculosis program in the country. So we will be requesting you to work on that front as well, sir. So in the meantime, people are switching on the videos. So may I request Dr. Jadeesh Kaur, so who has, who has summarized about this tobacco control from the perspective of SDG, but what is WHO CRO working on? So she might tell you briefly about the status of WHO CRO on this SDGs pertaining to tobacco control. So,
thank you so much, Dr. Sono. Thanks for this opportunity. I had a presentation, but because now, we have overrun the time, and because of the previous speakers, so and I have to leave for another meeting at 12:30. So I think I'm not able to make that PPT. So basically, for WHO Southeast Asia region, we are housing 1/4 of global population. That's too much. And then we have 80% of smokeless tobacco users global, and we have 20%, more than 20% of global smokers. So it's a big region, and it counts when we when we talk about the global tobacco control overall, and then also the NCDs perspective, and now the SDGs also. And most of the countries, they have made efforts to accelerate WHO FCTC in the past 1.5 decades, and they still are continuing. But as I said, that pandemic has pushed it back, So really, because there were other priorities, and then there was high interference by the tobacco industry. While most of the countries are showing a decline in tobacco use prevalence, both among the adults as well as the youth, because we have this regular surveillance system, except Indonesia. So Indonesia is a real cause of concern, and that is also both among the adults as well as the youth. So because this is one of the very high tobacco consuming country globally. So otherwise, none of the country, I think, is likely to meet the NCD action plan targets now. Earlier it was one as per the third trends report of WHO, but I don't think now anyone will reach that goal. And then SDGs, we are far, far behind. So we need to, like I earlier reiterated, that we need to make more efforts. We need to make collective efforts. So this is the scenario, and then this is a big tobacco growing region also,
Right.
So kind of two main countries, India and Indonesia, they are big producers among the first 6. So they need to work on the supply side issues also. We need to prevent our youth also from tobacco use. So these are some of the issues, and and I won't take time because you have to take the photograph and you have to move for the next session also. Thank you so much, Dr. Sono.
Yeah, thank you, ma'am. And I think nicely told that now it is the right time, as already focused by our guest of honors, that now we need to focus on our overall developmental agenda, that is SDGs, when we are talking of tobacco control, rather than talking very narrowly. So I think WHO will take this forward, and we'll be coming out with a newsletter. The next newsletter will be tobacco and SDG. So as a series of the newsletter, we have 13 newsletter already. So this is the 14th or 15th, Rajiv?
15th, sir, 15th.
15th.
14th we have already published.
Yes, so 15th newsletter will be our tobacco and SDG. So we'll be sending this newsletter to all of the participants who will be attending this program and along with the certificates. So thank you, all of you. And now I think, Rajiv, can you click a photograph? Although you might have clicked some before.
Yes, sir, we have already done all the screens.
But I think now the things will be coming smiling, no? So maybe one can click some more photographs. Huh? All screens. I think there are 5 screens.
Yes, sir, 7 screens. Done, sir.
Right. So thank you all, guest of honors. So now I think we'll quickly start our much awaited panel discussion. So so I think we will be. I'll introduce Dr. Rakesh Gupta, who is the president, ex-director, Health Services, Government of Punjab, and now Director of Public Health in Strategy Institute of Public Health Education and Research, which is an advocacy-focused non-governmental organization or institute, which has been working for last 3 years. So welcome, Dr. Rakesh, to this consultation. So myself and Dr. Rakesh will be moderating this panel discussion, and I request all the panelists to, briefly summarize, I think 7 to 8 to 10 minutes, maximum 10 minutes, about that particular specific topic which has been allocated. So I think, welcome, Dr. Rakesh.
Yeah, thank you. Thank you, Dr. Sono.
So our first speaker, can we go next? So I will like to introduce our chairs and co-chairs. Chair is Dr. Prakash Gupta, so the alumnus of tobacco control, and the co-chair for this session is Dr. Rana Jaising. So I'll hand over this thing to now so can Dr. Rakesh, can you introduce both of them?
Yeah, so Dr. P.C. Gupta, as we all know, is the doyen of tobacco control, and he has mentored us all. And he is the director of the HELIS Institute, Navi Mumbai. And Dr. Rana Jaising, so he doesn't need any introduction, but he is the regional director of the Union Southeast Asia for tobacco. And so welcome Dr. P.C. Gupta and Dr. Rana Jaising, so as chair and co-chair.
So now I'll invite both the chairs to coordinate this session and invite the panelists. Next.
Thank you. So who will introduce the panelist?
Sir, you can introduce, maybe if Dr. Swasti Charan is there. So maybe if, because he asked me that he has something on, so can we have Dr. Swasti before Dr. Gopal, if Dr. Gopal agrees to it?
Sir, I have a small request. I have another meeting at
12:30 you have.
Yes.
So you can, you can quickly, So
okay. So I think first let Dr. Gopal Chauhan go, because he has to leave at 12:30. That's about 7 minutes. So he has just about the time that you have given to complete his chart. And I want the slide is there. We all know Gopal Chauhan is one of the most active and successful worker in tobacco control. So won't say much about in Himachal Pradesh specifically. Won't say anything. The slide is there. Welcome, Dr. Gopal Chauhan, and please give your thoughts.
Thank you, sir. Are you able to hear me?
Yes.
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 Okay, sir. Is my slide visible?
Yes, it is.
Okay, sir. I will not take much time, and I was waiting for this kind of consultation for a long time. This is very, very important, and as you know that we have young scientists from the country, and this is a big agenda. I will be very short and brief about my talk. And thanks to the previous speakers, chair, and the organizers for giving me this opportunity. I will be talking about the commitment toward inclusion of tobacco control in SDGs agenda. What is the global experience? I will not take much time. I think it will be 5 to 7 minute talk. Briefly, if you know that what are the biggest problems across the globe. This is a slide, this is a bit, older, I think from 2017. But we can summarize that, if you see one thing only about nutrition, 21% people are overweight, 63 are adequate, 13 are undernourished. It means that there is some inequality, there is some inequity, and we have to match those, inequalities and inequities, so that we can have a, peaceful world. Otherwise, if somebody are dying due to hunger, poverty, another persons are living with, very, very rich kind of resources, then we cannot have, peace and harmony across the globe. The possible solution for all these things is this is, we should have some equality, and the ultimate solution is equity. Under the principle of this equity, I think the fundamentals of the Sustainable Development Goals and MDGs are there, because every target, every goal that talks about the equality and equity. If you know about the origin of the United Nations, it was the World War II. We lost 70 to 80 million people, more than that. And you see, most of them were young people. This was a man-made disaster. But the best thing came out of it is the, origin of United Nations in 1945. The core agenda of United Nations remain peace and prosperity through development. This is the reason that it may be MDG, Millennium Development Goals, maybe Sustainable Development Goals, but the core agenda is peace and prosperity, and through the means of development. That how to measure the development. The most common tool we use is the Human Development Index. And you see that in 2007, Norway is having around about 0.9, the HDI score. And India, it is 6.64. And for Niger, it is the lowest 0.3. It means that, there are a lot of inequalities, lot of inequities across the globe. And one rich country cannot live in peace and harmony if the neighbor country is not doing good. It means that you have to uplift the neighbor countries, neighbor, your neighbors also, so that a harmony and peace can be established. These are MDGs. You all know about it. We were having the 8 million development goals. The baseline targets were 1990, but they were, notified in 2000 to be achieved in 2015. In Indian context, there was a, report, MDG 2015 in India. We have been able to achieve a lot. I cannot say that we achieved 100%. We were able to reduce the under 5 mortality rate, and MMR dropped significantly. There is a decline in the HIV prevalence, malaria incidence declined, the TB cases nearly half. But we could not achieve for example, we were having the MMR target of 109. We could land up to 137, but the 137 we achieved is coming from 560. It means there was a huge decline, whatever the policies, whatever the programs we were having. Now coming to the specific, to the Sustainable Development Goals, my previous speaker has very nicely summarized almost every component of this SDG agenda to be achieved by 2030. Simply, we have 17 goals, we have 169 targets, and goal 3 is dedicated to health. But knowing this journey is not possible without understanding the definition of sustainable development. This is not for the the senior colleagues. This is for the young researchers, because I asked Rajiv that who is the audience. They are young researchers. They should know that the definition of sustainable development is meeting out the present needs without compromising the needs of the future generations. It means this is the sustainable development. It is not only development. This is sustainable development. Whatever we have to do, we have to keep eye that what the future generation will be doing. The role of the countries and states is to make policies, programs, and intersectoral convergence, as has been told very nicely by my previous speaker. And more important is resource mobilization. If you see the biggest study of the 188 countries, the baseline about SDGs 2015, they have developed a SDG index. And as per the SDG index, Iceland is at number 1, Singapore is number 2, Sweden is number 3, as per the SDG index. India is at 43rd place. And in MDG index, India was at, with a score of 40. You can understand that we have to do a lot as a country, because out of 188 countries, we are ranked at 143rd place. And 142 countries are ahead of India. It means that our policies, our program should be very much, in coherence with the global SDG agenda. Why we need to achieve this SDG agenda? Because many states, many persons will say that it is not our obligation. We have our own priorities. Why as a nation, this is very important to achieve those SDG agenda. We are struggling for a permanent membership in the United Nations Security Council. People say that if you are not able to control diarrhea, if you are not able to control TB, if you are not able to control the communicable disease in your country, then how you are going to take control of rest of the things? It's very important. It means that we need a lot of trade and commerce we need a lot of overseas employment, we need good relationship with the countries, and we need a lot of FDI. This is the reason that we need to achieve those SDGs as a country. And they have been summarized very nicely by my previous speaker that, what are these different goals? They talk of poverty, hunger, and health, safe cities, inequalities. But I would like to say that 8/17 goals are related to tobacco. You cannot think of, achieving those SDGs without achieving effective tobacco control. For example, we have MMR. Our target is, this is 70. By 2030 as a nation. In current position, we are at 130. We have to achieve it. We have to go down to 70 by 2030. But there is the tobacco factors in there also. And there are state-specific plan, and I am one of the planner for my state. For example, we have set a target for in 2015 we were at 22% as per the GYTS. And our target was by 2020 by 17%. Then for 2024 we have a target of less than 10% prevalence, and by 2030 we have a target of in the state for reducing the prevalence of tobacco use by less than 5%. This is a document, a vision document of the state, but the country is having a different vision document. Country has given the leverage to the state to develop those policies and to make the plans accordingly. In summary, I would like to say that tobacco control is must for NCD prevention control. It relates to maternal health, child health, TB, substance abuse, out-of-pocket expenditure, pollution, medicine, research, health worker density, and capacity building. But in the end, I would like to say that we cannot imagine SDG success without effective tobacco control at globally, nationally, and subnational level. Thank you very much for giving me the opportunity.
Thank you very much, Dr. Gopal Chauhan, for your address and for your work in tobacco control. I would just make one observation. In the GYTS latest round results released day before yesterday, the prevalence in Himachal Pradesh is one of the lowest, whereas prevalence in Uttarakhand and UP are very high. So, that is a success of tobacco control in Himachal Pradesh among children. And Dr. Gopal Chauhan, I think you have a very big role in that. So congratulations. Now I introduce Dr. Swasti Charan. I think everybody knows he is a additional DDG in Directorate General of Health Services, a great friend of tobacco control, very active in tobacco control, and has many, many achievements already in many fields. So I won't read everything, but would like to hear from Dr. Swasti Charan much more on the initiative undertaken by MOHFW for attaining tobacco-related SDGs. Dr. Swasti Charan.
Thank you, sir. Good afternoon, all the panelists, my fellow panelists, as well as participants. It's indeed my pleasure here to be amidst the luminaries here. And I know many of us are already working in tobacco control. So in a way, we are trying to churn out something out of all the knowledgeable people here. So I would not be making any presentations on what are the initiatives that the Ministry of Health has taken with each one of you. You all know that we do not do anything alone. It's all done with the help of the state governments. It's all done with the help of the civil societies, the institutes like PCI, JIPMER, etc. So we all know it. Rather, what I would like to, dwell upon is linking SDGs with tobacco. We all know why we need to link tobacco. The other day, one of my colleagues was asking me, why tobacco control is very simple. Why do you keep wasting your time here? But I would like to say here that, this is the best investments which we all can do for controlling many of the diseases. It's linked with poverty, it's linked with many indicators of health in the whole world. It looks simple, but it is very, very difficult. The moment you go into it, you are into many false areas, what we call bulbulaya in Hindi. It leads into some areas which you think is easy, but it's like, it turns out, they will turn out to be very, feel-good factors that you are happy that you are doing something for tobacco control, but it is not impactful as well. So with those aspects, we have tried to list out some of those priority areas where we need to, concentrate for tobacco control in order to let the country achieve the Sustainable Development Goals, particularly the target 3A, which is, reducing 1/3 premature mortality from NCDs and from the NCDs, as well as, target A, which is to strengthen the implementation of the WHO's Framework Convention on Tobacco Control in all countries as the progress. So we mean to say that if you want the tobacco control aspect to be done, it is implementation of the WHO FCTC, and implementation of WHO FCTC is an all-encompassing area. So we need to prioritize some of those areas now. The first thing which I would, would like to initiate here is the National Tobacco Control Policy. We have many activities going on. We have a dedicated tobacco control program with many components. We also have a dedicated NCDs program and other related program. But where is the tobacco policy? Do you have a blueprint with which we can follow that in future we could be targeting towards not just attaining the Sustainable Development Goals, but also a total end game for tobacco? This is one area which I would be working towards in the near future. We would be working involving a lot of you to prepare a clear roadmap with targets and timelines for tobacco endgame. We have done some of the activities, but rather this is a very neglected area. And then we would like to also revisit ourselves, the National Tobacco Control Program, aligning ourselves with the SDGs and also mapping all the activities which are possible. What is happening in ministry and many state governments is we all tend to work in silos. We have different programs, which is called Tobacco Control Program, and we have got the NCDs program, we have got DTAP program for the drug de-addiction. We also have many programs targeting the youths, the school children. But if we all have tobacco or all agendas considered together, we would be achieving further. That way, we need to revise the National Tobacco Control Program operational guidelines. And doing that, we have, in the last few years, we have also learned many things that the QUATPA that we have now may not be just enough. We would be happy, and we have been implementing whatever is there in the provisions of the QUATPA 2003, but there is a need for the amendment. So the government's initiative for tobacco, QUATPA 2003 amendment is also one area where we are also focusing. Then, in a way, see, I had already told that we have a program, then we do some activities, we feel good. But are we really accelerating the agenda of NTCP in the states and districts? Are we covering all the components of what is let down in NTCP? That we need to understand as well as act each other. Have we done a real time checking yourself, monitoring yourself whether you are doing it? So we got some money, say for example for a district, we got some money for the state, and then we start doing activities which are very easy, very easy to do, but not very impactful. So we need to monitor ourselves, and Dr. Prakash Gupta sir had just said that in the last launch of the GYTS, we had also launched the HMIS system for monitoring ourselves. So please, all of you who are here, help us monitor ourselves or monitor yourself with the indicators which are already there in the HMIS, which is the monitoring system that we have launched. There we will be able to know that our states, Dr. P.C. Gupta sir had already congratulated Dr. Gopal Chauhan. Tobacco is, one program where sincerity is very easily seen, and because we do have the indicators of the indicators which can be proxy indicators of the sincere efforts of the state government. So that way, the Global Youth Tobacco Survey, Global Adult Tobacco Survey, the third round, which we are planning now, will be able to do it. But then it comes only 5 years, even 6 years, even more. So on a real-time basis, we need to monitor ourselves, and that is how we have done the SLCC. We have done the HMIS to assess the working of the SLCC and the DLCC. Then, with that monitoring, I am hoping to find out which SLCCs and the DLCCs are working well. So can we come up with a model plan, with a model, say if a new state nodal officer joins someday, then we tell them that the SLCC, the state level coordination committee consists of these, they have meetings like this, they work like this, and the agenda of the meeting is prepared like this, and the actionable points are being taken out like this. Does that state nodal officer, have a toolkit with which he can just start working on? Otherwise, what will happen? He will start looking at the schools. He will start looking at the sensitization workshop with some stakeholders, which are very easy to do, but which may not lead into the reduction in the prevalence of tobacco in the country. Now, the major factor that we have is the budget. The budget, we all say that tobacco is list funded, but I would rather like to say it otherwise. So nobody stops you from asking budget from the PIPs. The PIPs are very, very flexible. You can convince the state government and ask it. And whatever money you have got through the NHM, they are all flexible again. They can all be in a way, linked together with different programs. Say, for example, you got some money for IEC for NCD program. You got some money for IEC for oral health program, and say for tobacco control program. What we can do as state nodal officers, we can meet together. The IEC material which you prepare can start from chewing tobacco, which is part of the NTCP, leading to oral health diseases, which is now part of the oral health program, and then leading to cancers and other cardiovascular diseases or any other disease which is now linked with NPCDCS program. So you have spent some money which can be pulled from all the three programs and then launch it. The target population is going to be the same. Instead of doing that, if you have one from oral health, one from tobacco, one from NCD, the target population is going to be bombarded with three different kinds of messages which you could have combined together. So those kind of organizing ourselves or organizing the funding mechanism that we have is also very, very important. And the other thing which we have taken up in the last few years is the National Tobacco Testing Laboratories. We have started on a solid ground, but we need to go further. We need to go further. We have tested nicotine in pan masala, which should not be there, and we have utilized that data for banning pan masala. But then beyond that, we have to start now looking for working in such a way that the scientific basis for tobacco is also in that area. Say, for example, the regulation science which needs to develop with the inputs from the NTTS is one big thing which we are hoping at. The nitrosamines, the nicotine, and beyond the nicotine, is there any other addictive substance which is there? We do not know. And beyond the nitrosamines, what are those chemicals which are harmful as carcinogens, or those agents which are harmful as for the cardiovascular diseases or many other diseases that we all know. So that missing link is where we need to find out, and that link, if we once find it out, then utilize that scientific knowledge for regulations and public health policies for tobacco control will finally lead to engaging the country, engaging the whole of us towards the SDGs. So I think it is very difficult to summarize in few minutes what are the administration's intentions and initiatives towards SDG. I would like to stop here. Thank you very much for inviting me.
Thank you very much, Dr. Swasti Charan. I mean, you explained very beautifully, very cogently the advances and the things that are being done in MOHFW for tobacco control and SDGs. And they are all, I know, with your contribution, your major contribution. So thank you all very much. Now, can I invite my co-chair, Dr. Rana Singh, to introduce remaining speakers?
Yes, thank you, sir. Thank you very much. So we have already heard about the global perspective of implementation of Sustainable Development Goals and tobacco control. We heard from Dr. Swasti about what Ministry of Health and Family Welfare is doing on different aspects. I would also like to inform the participant that Dr. Swasti Charan is focal person for reporting the progress on FCTC implementation in our country. So he observes each and every component of FCTC, the progress on different aspects, and reports to the FCTC headquarters secretariat. So thank you, Dr. Swasti. So now we move to our next speaker, panelist, Ms. Prachi Kathuria. Prachi Kathuria is a Deputy Director at Hirde, coordinating the Healthy India Alliance, to which Hirde serves to be Secretariat since 2015 and 2018. Kathuria has been working towards ensuring meaningful involvement of youth and people living with NCDs. So I think I will like to invite Prachi Kathuria, and she will be speaking. We always say health for all, but now there is another concept, health in all. Inclusion of tobacco control in all the development agendas. So over to Prachi.
Thank you, sir, and it's an absolute pleasure. Thank you for starting. It's an absolute pleasure to be here in this panel discussion, and it's also a pleasure to be introduced by Dr. Rana, because he's a governing board member of the Healthy India Alliance that he mentioned, and has been leading the work of the Alliance with other Alliance members. And I'm here today to talk a little bit about, and I'm sorry if any of my slides or the things that I present are repetitive, because all the experts and speakers today have really talked about what health for all and health in all really looks like through multi-stakeholder and multi-sectoral engagement. So I'll try and give an overview of what this whole movement around health in all policies really looks like. And just to give you a brief outline of what the presentation is going to be, we will talk about health in all really supplementing health for all rather than substituting it. So how do we strengthen the narrative of health for all, which talks about universal health coverage, which talks about affordable access to treatment, medicine, care, prevention services for NCD prevention and control. And of course, tobacco forms a big component there, given the tobacco burden within the overall NCD burden is the highest. And then we will also try and understand what regional and national level efforts look like when we talk about health in all policies approach, what multi-stakeholder and multi-sectoral engagement looks like, and going forward, what can be done for tobacco control. And in terms of SDGs and tobacco control, how important it is for all of us as civil society organizations, as youth leaders, as people living with NCDs, to understand that it's important that SDGs, and we have been hearing about what SDGs are since the start of this webinar, and we have quite a bit of understanding of how it was formulated, what are commitments, what are member countries up to, and what are they planning to do. And we know that we are off track the targets, definitely. But in terms of country level implementation, how do we really try and decode localizing sustainable development, and in that sense, what can be done going forward? This is what was said by FCTC in 2015, the Secretariat, when the SDGs were being formulated, that as a world together in 2015 was gearing up to develop the post-2015 agenda for sustainable development. They said no country can afford health, social, economic, and environmental consequences of tobacco. And therefore, it becomes very, very critical that sustainable development goals bind the work of health as well as non-health sector partners for achieving health for all and making health, the well-being of everyone in the country really a priority. In terms of what health in all policies really looks like, the framework that was given by WHO in 2013, it really tries to, for countries to follow, gives broad headings of the framework where it says need and priorities for health in all policies. And it's essentially that all policies, be it health related, be it development related, be it environment related policies in each country should eventually focus on improving health equity and health of the population. So in a nutshell, that is what health in all policies really is for us to understand. Followed by frame planned action, as multi-stakeholder engagement really comes into play here, identify supportive structures and processes, and we all come together as different stakeholders, different ministries, different civil society groups all come together, facilitate assessment and engagement, and ensure monitoring and evaluation, which definitely is a very important component. And all of the respected speakers before me have mentioned that monitoring, evaluation, reporting goes a long way when we talk about sustainable development. And across all of these framework elements, we do talk about building capacity of different stakeholders as we go forward. In terms of bringing on board development sector partners, here is an excerpt of the World Bank report from 2014 that says health in all policies can be applied to NCD prevention and control from 3 different entry points: risk factors, population groups, and sectors. And by population groups, the inclusion of a life course approach, where we are not just talking about, say, prevention or treatment, we are also talking about aspects like palliative care really comes into picture. This is again guidance that was given by WHO in 2013, where the need for a multi-sectoral action plan being developed at all within countries at country level was felt, and it was emphasized that a whole of society and whole of government approach is what will take forward the NCD agenda. In prioritizing tobacco control, as I mentioned, given the burden that tobacco really levies in terms of NCD-related mortality and morbidity. At the regional level itself, we have a WHO regional HIAP framework that focuses on different aspects and different pillars of the whole ecosystem. It talks about governance, it talks about national development strategies, and it talks about the framework. So all 3 of them going together, and then we trying and reaching into development of a health in all policy framework within the countries. In terms of the national level leadership, the national health policy very proudly does mention and emphasizes on the need to adopt a health in all approach to complement health for all. And this is what I was mentioning at the very beginning, that we are in the era where we are talking about universal health coverage as well as sustainable development goals, and none of these can be achieved in silo. It has to go together. And for sustainable development goals to really become a reality, now that we're talking about tobacco control and its strong linkages with environmental health, it's important to also acknowledge here that out of all of the sustainable development goals that we are talking about, environment related goals are the least progressing right now, and we definitely are facing a lot of challenges there. So there might be an entry point of integrating tobacco control within the overall environment related goals and targets and indicators, and then strengthen the narrative further. Sorry, this is the same slide. After the guidance from WHO in terms of developing the multi-sectoral action plan, India has a national multi-sectoral action plan, and as Dr. Jadeesh Kormam was mentioning, that in the Southeast Asia region, there's just one country that does not have a national multi-sectoral action plan, and this action plan really talks about leadership being taken by about 29 ministries in prioritizing NCD prevention and control, and it goes even to mentioning that apart from government stakeholders, it's also important to have civil society as a key stakeholder coming on board. In terms of what has been a recent development when we talk about health in all policies is in 2017, there was a world conference held in Montevideo, and it was all around policy coherence for target 3.4 on NCDs. And here, of course, it specifically mentions about tobacco control. And the outcome document of this meeting itself talks about engaging more and more partners and stakeholders beyond health. So what I would like to, through these slides, emphasize on is that there is enough precedence, enough importance being laid on engaging through a health in all policies approach. It's now also with a national multi-sectoral action plan in place that guides this process in India. I think it's going forward, and in the interactions that we have had with multiple stakeholders, we have understood that the implementation of the National Multi-Sectoral Action Plan is something that is being rolled out, and at state level discussions are underway. We have been hit by a strong pandemic, and that definitely has shifted the priorities to broader public health services. But going forward, what COVID-19 has also taught us is prioritizing NCDs as including its risk factors, for example, tobacco prevention and control, will definitely improve our outcomes in terms of COVID prevention and management itself. In terms of multi-sectoral action being led by multiple stakeholders for tobacco control, what really makes a strong case for us is that tobacco control provides a good example of and potential impact of multiple stakeholders being engaged for NCD prevention and control itself. So it's a vice versa and a mutually strengthening kind of a process where tobacco control efforts lead to strengthened NCD prevention and control efforts, and vice versa. Effective tobacco control involves not only addressing it at the individual level, but also again leveraging the multi-sectoral action plans at all level. And the United Nations even emphasizes that SDGs need broad spectrum across communities. And there's a role for government, there's a role for civil society, there's a role for young people, as well as people who have lived experiences, and it's very important that way. Integration with developmental agenda, just two slides talking about it in terms of the roles and responsibilities that could possibly come under the health sector, as well as some for beyond the health sector, development sector partners. Recognize potential health impacts from policies and actions. Whatever policies are being formed, it really has a linkage to what impact it will have on population health and health equity. Address shared visions and health and social equity. Enhance intersectoral action and collaboration. Share contributions of health and development. So again, it all builds on a mutually beneficial model that we're talking about. One example here is the UN Interagency Task Force, UNITAF, that really prioritizes implementation of WHO FCTC for taking forward the NCD agenda. And in the joint programming missions that are carried out at country level, tobacco control is a major priority for the missions. These are again some examples of the other development sector partners at a global level prioritizing tobacco control within the work of their organizations, and these PPTs will be available to you, so you can always refer to them. Just one mention here quickly. I know Dr. Rana has switched on his video. Probably that's a call for my end of the PPT. But just one important point is that for SDGs to really work in the context of the country, it's really important that local solutions are found. And I have put these pictures just to give an example. Within our team, we tried to do for each SDG what impact does tobacco control related efforts have for India specifically. We do have information available for tobacco control affecting each of the 17 SDGs globally, but for India, we also tried to do that. And you will see that this information really helps us understand where, for example, when we are working with partners of that sector, what is the sort of language and what is the sort of pitch linkage that we can work on that will also convince them that it's important for them to consider tobacco control as an important area of action. So these are some examples and just some takeaway messages for us. I think addressing prevention of NCDs, most notably through tobacco control, is very, very important. And we have to acknowledge the role of those who live, who have a lived experience, be it themselves, be it their family members. Their narratives are important to be brought to the forefront. Implementing WHO best buys that talks about tobacco taxation as a means to strengthen tobacco control action, and research, very importantly, that cuts across disciplinary boundaries and that provides enough evidence for us to say that SDGs have an interlinkage, and multi-sectoral action is what that will take us forward in tobacco control. The last but not the least, localizing SDGs, as I have been saying, and co-production of place-based case studies. And by that I mean that, for example, in India, at state level, SDG localization is something that is being operationalized right now, being led by UNDP. And that localization, as and when it happens, it's important that case studies and best states in the sense of at least being able to localize specific SDGs and work on them. These should be highlighted for other states to replicate and for course correction if needed. That's it from my side. Happy to take any questions.
So thanks, Ms. Prachi, for beautifully explaining health in all and tobacco control and inclusion in all policies, and not only in health. You see, we continue to speak repeatedly, talk about multi-sectoral engagement in tobacco control. It is one way. Mostly, I find that whenever I speak and many of our colleagues speak, it is mostly one way, multi-sectoral engagement. Yes, the people who are involved in tobacco control, they want to bring more and more people should be involved. But I think you explained that it is not only multi-sectoral engagement, but multi-sectoral action is required. Whosoever is responsible, they need to ensure that they regularly discuss tobacco use, tobacco control issues, and how they can contribute in that endeavor. So thank you very much. Yes, research very, very important. You have highlighted multidisciplinary research is very crucial to ensure that we have enough information related to tobacco and the role of various stakeholders. So thank you, Ms. Prachi, once again. Now, I am pleased to invite Dr. Rakesh Gupta ji, who is president of Rajasthan Cancer Foundation and honorary consultant at Santokh Abdullah Jibbi Memorial Hospital and Medical Research Institute. You see, when we talk about Dr. Meera ji, Dr. P.C. Gupta ji, Dr. K. Srinath Reddy, who I think the people who spearheaded tobacco control, who really highlighted that tobacco use is an important issue in our country. We also remember Dr. Kesh Gupta ji. And the work which all of them initiated, all the discussions, all how we have today we have legislation, cigarette and other tobacco products act, National Tobacco Control Program. So a lot of efforts were put in by all these people. And Dr. Kesh Gupta ji, when I came into tobacco control, so one of the first initiative of smoke-free initiative, along with the city of Chandigarh, it was smoke-free Junjunu. Where some initial experiments were done, whether we can really go smoke-free, whether we can really make a city as smoke-free. But in addition to that, when we talk about total tobacco control, supply side, demand side, one important aspect is tobacco cessation. Very, very difficult part. How tobacco control happens, we need to stop new people from starting to use tobacco and help those who are already using tobacco to quit them. 267 million tobacco users in our country, and how we can help them to quit tobacco. So multi-sectoral, he often talks about a package. Can we have a package of tobacco cessation services in the country, and how tobacco cessation can contribute to sustainable development goals? So I think it is only Dr. Kesh Gupta who can really explain that part in his own way. So thank you, Dr. Kesh Gupta. Over to you.
Thank you, Dr. Rana ji, for very kind and generous introduction. And I would speak about tobacco cessation in the reference to SDGs, as has been the task given to me. And when it was told me that you have to talk about this, I said SDGs do not mention about tobacco cessation. So what am I going to do? But yes, there is a lot which has been mentioned today by a lot of speakers as to how SDGs are addressing tobacco. Although the address definitely is more on the, I would say, is on the indirect address through the SDGs. In my perception, Dr. Gopal has given some list as well. In my perception, the goals are 1, 2, 3, 5, 8, 10 to 13, 15, and 17. But broadly, if we have to say as to where we are with the tobacco and SDGs, I think tobacco requires to be seen in SDGs because its consumption and productivity affects the or impede the implementation of SDGs, because SDGs is concerned with people, their dignity, the prosperity, the partnerships, their environment, and lastly, the justice. So I consider that if we see it in this perspective, there are lots of arenas in which we can address SDGs and tobacco. WHO Europe has given and converged it further to 6 SDGs. Third, of course, is definitely addressing tobacco more directly, but the first has been described already in details by everybody, the poverty. The gender equality, I always remember Miraji here that we need to talk about women in reference to tobacco, not only the men. I think that is very important. Inequity among countries, I think Dr. Gopal has dealt with it very nicely and graphically. I'll never forget that picture as to how the inequity can be definitely improved upon by uplifting the lower and middle income countries. Sustainable consumption and production definitely is an issue to be looked into, and also the strengthening of global partnerships. So this is kind of converged view, but yes, a detailed reference has been made in the, so it can be found in the Google search. Surprisingly, UNGA does not mention tobacco under substance abuse. It's almost an analogy like NDPS Act, which has not covered tobacco under the addictive substances to be controlled by this act. And this is something which could be a function of tobacco industry influencing UNGA even. So I think that is where we need to look into. I'm mostly talking about what has not been talked about, what has not been covered, which many people may say that this is all negative that you're talking, but I think we need to talk about the rectifying measures as well. The good part is that, yes, SDG Target 3A has strongly recommended strengthening implementation of the WHO FCTC in all member countries as appropriate. I think that is where the vagueness comes in the implementation. Also, the SDG 4 Target 3.4, which says that reduce mortality by 1/3 in NCDs by 2030, which is fine. I do not disagree with it, but I think we need to be a little more specific country-wise when we are talking about this specific target. Thankfully, the World Health Organization has developed the target of reducing tobacco use by 30% by 2025. I remember talking to Dr. Srinath Reddy, and because he was in that meeting, and I said, do you think that this was the right way to go about? Because countries with the high burden of tobacco should have had a higher target of reduction, say in India by 50%, not by 30%, because many more people will be dying if we keep the global target uniform throughout all the countries because of the inequities which are persisting there. Nevertheless, the WHO Empower report on global tobacco epidemic of 2019 has put a special focus on tobacco cessation, the topic which has been given to me. I consider it has given a lot of information as to where we are with it, but there are two things which require to be remembered. Although it has progressed definitely as the second most indicator in Empower, but the least number of countries which are adopted is also one of the features of the O component of Empower. So I think those are the two things which have to be taken together. The tobacco cessation under FCTC is covered under Article 14. And I was looking into the guidelines of implementation through this WHO report of 2019. What I found that there are certain words which have been repeatedly referred to: the parties, the infrastructure, resources, health system, healthcare providers and workers or SCPs, population and individual approaches in tobacco cessation, training, data collection and reporting. All of this has been talked by all the eminent speakers before me, so I'm not going to go in the details. But I think these are the words which should not be just taken as words, but also taken as the targets for the action as to where we are with each one of these in the terms of our collaborative approach in the defining the outcome measures and achieving those. So for me, the O in Empower is not orphan anymore, definitely, but there are two more things which we can derive it. The one is the onus, and the onus here is on policy planners for the political will that they should be able to develop, generate nicely, provide adequate resources, provide robust implementation, also have the transparency, and also the monitoring and evaluation on a regular basis. I hope what Dr. Swasti has said will be realized very soon under NTCP. And lastly, I think it is important to also develop the accountability. Without developing an accountability, the actions do not happen. This is my perception. I have still not been able to change this after the last 40 years. The second thing is in onus also lies on health systems and healthcare professionals in establishing tobacco cessation clinics as a systems approach. Also, a systems approach, for those who do not know, means screening all tobacco using patients when they come at the hospital as new or follow-up patients, treating them optimally through the tobacco cessation delivery, whether it is given through the tobacco cessation clinic or directly by the consultant, and then following up of these patients. I think that is very important. So whether we have TCCs or not, if our healthcare professionals, each one of them is able to provide the treatment to each tobacco using patients at every clinical encounter, I think that will make a significant change in the quit rates we have currently. And current quit rates definitely are dismally low at the population level, less than 2%. And amongst the current smokers, it is 16.58%. In the smokeless tobacco users, it is 5.8%. I think we need to improve a lot more on the current status of the quit rates. The third onus is on the medical, dental, nursing councils for giving the credit to what work is done in tobacco cessation. That is very important. CME points should be assigned on an annual basis. A target should be fixed that, okay, this is how much each and every member of these councils should be able to achieve in a given year. And also similarly, the respective associations have a responsibility to hold the seminars, webinars, which is now very easy as we are seeing to reach to the many members. It's very important that they hold the specific sessions on tobacco control and tobacco cessation to work on this. So for me, in Empower, O is for onus, and also it is an opportunity for the communities. The communities have to know the benefits of quitting. How can they know about it? If the mass communication campaigns are held, which are being held for adverse impact of tobacco, but there's also a need to hold these for providing the benefits of quitting simultaneously. Second is to demand treatment. When they go to the hospital and health facilities, if there is a tobacco using patient which the caregivers are taking to a hospital, I think it's very important that they also demand treatment, because tobacco use is a disease, tobacco user is a patient. Unless we develop this norm, I don't think people will change their attitude and behaviors towards demanding the treatment for tobacco. The third part is that we need to declare our public places, our workplaces, the transports which they use, tobacco free. It's great. Dr. Rana has done a lot of work on smoke-free India. I think it's now time that we also begin work for tobacco-free India. We have developed Alliance for Tobacco-Free India, but I think we need to have a lot more activity happening through that to perhaps realize this goal as well. So the O is now for onus and for the opportunity. Correlation of SDGs and NCDs and tobacco, as we see, we have all known that yes, Ministry of Health has been working tremendously and significantly in bringing in tobacco control. Many times we do feel frustrated little that this is not happening, that's not happening. But tobacco is indeed a multi-sectoral issue, as has been highlighted by Dr. Prachi also. So I consider that the need is the interministerial coordination is very important. We are paper tigers, definitely. We have everything on the paper, but are we really working on the set agenda to get the outcome measures as have been defined? I think that's a point to be pondered on. I was reading the third progress report, 3.0 version of the progress report this year of the Ministry of Statistics and Program Implementation. It has not mentioned anything on when it's mentioning on NCD SDGs for NCDs. So I don't think it has even thought of working on tobacco as one of the national indicators in its framework. So I think that is where Ministry of Health and Family Welfare can coordinate and collaborate with MOSPI to bring about this change. From the next, at least in the next progress report, it should have a mention for NCDs as well as for tobacco and tobacco cessation as well. So to conclude, for UNGA, I would say it should specify tobacco as the topmost substance abuse under its heading of substance abuse. And also it should prioritize a timeline for the world to be tobacco free, maybe in over a decade from now. But even this time, with this timeline, the cost is of 80 million human lives, which I think Dr. Gopal's slide had mentioned, this is what we lost in the Second World War. I think we need to really think about it, that we should minimize this calamity as much as possible and as early as possible. For Ministry of Health and Family Welfare, I consider it should coordinate and collaborate with other stakeholding ministries as has been recommended, and also with the Ministry of Statistics and Program Implementation, because the figures definitely make a difference, to focus afresh on its priorities under SDGs to address the major risk factors of NCDs and tobacco in particular, and tobacco cessation delivery as number one priority. I put it as number one priority because it is doable, something which can be done through our health professionals for every patient who goes to a health facility. So I think that is where we can make a change without depending too much on the rest of the stakeholders I consider. And that's why I consider tobacco cessation delivery should become a number one priority. I thank you all for your kind attention, and over to Dr. Rana ji again. Thank you.
Thank you, Dr. Rakesh, for always giving some new perspective to our work, and the way you have explained. Oh, people often used to say earlier as although it's offer, but now you mentioned about onus. Yes, so very important. When we say that empower, so people also talk about empower plus, that what are the other components which can be included in empower. So yes, onus and opportunities, I think these are very important points you have raised. And yes, very important, tobacco use as topmost substance of abuse. Definitely it is, but still it has not been included in that list. Yes, very true. Interministerial coordination you highlighted. Yes, I think a meeting is long pending, although small coordinated work often happens, but I think it should be more streamlined. Then you also mentioned about tobacco cessation delivery as number one priority. I think, yes, it's very, very true. So thank you very much, Dr. Rakesh. So now I would handing over to Dr. P.C. Gupta ji for continuing this session, and then please sum up, sir. Sum up after our next session. Thank you very much.
So I think, sir, next session is Dr. Prakash Gupta only, sir. I
Okay.
think it's the last session for the day. So it is about prioritizing research in
Yes.
tobacco control for attaining.
Yes. So once again, I am pleased to invite and introduce Dr. P.C. Gupta ji. I think a lot has already been said about him. He is definitely our mentor, guide. We read, we consult a lot of the work done by him. So over to you, sir. Thank you.
Thank you very much, Dr. Rana and Dr. Sonu Goyal. Very generous introduction. I must say that I have not prepared any presentation. And now I think I'm glad about it, because I'm a research scientist. And if I have to talk about prioritizing research in tobacco control, that's what I have been doing for more than 50 years. So it will be I cannot make it a very short presentation. But now the time is very short. We are already over time. So I will just try and give just a few examples and finish it in a very short time, because don't want to go too much, don't want to keep everybody for a long time. So, I was just remembering in 1960s, early, when I started, early 70s, the US Surgeon General report and few other reports had already come on the relationship of smoking with lung cancer. And the attitude of many persons, even in public health that time, was that we have done whatever was to be done, and now the cigarette smoking and tobacco problem should go away because it is causing cancer. And of course, now we are here after more than 50 years and we are still discussing the same problem. And but a lot of progress has happened. And how is it that a progress has happened? And that is because of continued research in tobacco control. I can just give you a couple of examples. There are many examples I have, but I can just give you a couple of examples from my own experience. Up to in 70s, there was nothing about smokeless tobacco anywhere almost. In 1985, I happened to be at Harvard at Boston in a fellowship. And there was this public hearing for putting warning labels on a smokeless tobacco product. So I deposed in the Massachusetts Department of General Health in those public hearings and realized the level of lack of knowledge that was there on smokeless tobacco, not only in USA, but globally. In India, we had better knowledge. And over the years, with the help of research, much more in India than anywhere else, smokeless tobacco also has come to somewhat similar level as smoking. Still not the same level, but quite a high level for tobacco control as compared to what it was earlier. And that is all due to research on this particular topic. Give you another example. We had no estimate on mortality due to tobacco up to 1980s, early 90s from India. The global estimates were that WHO was making estimate, and of course, US was making estimates. From my very limited research data on cohort study of oral precancerous lesions, I made estimate for all-cause mortality. There was no cause-specific data. All-cause mortality due to tobacco, and published that as 630,000 deaths per year. That was in, I think, 1990 or somewhere around that. And that caused quite a lot of commotion because it was a very high estimate according to everybody internationally. And we didn't have that kind of a data. And I was advised not to do that, not to publish that, but I went ahead. I said, this is my data and I'm confident, and published even though I don't have full explanation. I cannot divide into diseases that will total to 630,000. And many others also tried, my friends, but they could not. And we came to know the reason about more than 20 years later, that at that time, we didn't know that tuberculosis was a major death that was being caused by tobacco and smoking, and that was not included those days. In fact, right up to Dr. Bharadwaj, I think you mentioned, he's probably here, right up to 20, 25 years back, even to get a TB specialist, there were many TB specialists, to talk on tobacco or smoking was very difficult, because I tried that. But then the research results started coming out, my own cohort study and many other studies, they started publishing research results. And slowly, and with a review from Union, an international review from Union, and then from WHO, it became a generally accepted fact, and now very accepted fact, that tobacco tobacco and smoking affects TB. In fact, Dr. Sunila mentioned her own research of her own student in this regard. So now, of course, it's a completely accepted finding, but still a lot of work has to go in putting it in TB control. In the same way, smokeless tobacco and reproductive health. From West, we knew a lot about smoking, and Dr. Sunila in her talked a lot about smoking and reproductive outcome, you know. And there were also in poster competition, the photograph competition, there was a photograph of woman smoking, pregnant woman smoking. There was very little knowledge, although there were some indications that smokeless tobacco use also affects a reproductive outcome. But with the help of a cohort study that was conducted in Mumbai, nearly 1,200 pregnant women meticulously recruited and followed up. And then we looked at the effect of smokeless tobacco use on pregnancy outcome. And very clearly, low birth weight, lower gestational period, higher higher infant, higher stillbirths, and all those kind of effects. And then it gained not only recognition from India, but also international recognition. In fact, anecdotally, and I was in a meeting, and a lady from Alaska, she came and hugged me. What for? Oh, you published this work on smokeless tobacco and reproductive outcome, and I'm struggling with that subject in Alaska because there is smokeless tobacco, but we can't do anything. We don't have any evidence. So, any research that is done anywhere can influence and does have influence everywhere else. So, like that, I can give. There are many examples that can be given. The same thing about BD and about other aspects of smokeless tobacco. But I think I would refrain here and just say that there is no shortage of researchable subjects and research subjects that will make a huge impact, that can potentially make a huge impact. One has to really look for, and especially in relation to SDG. Now, already a lot has been said. I mean, Dr. Prachi Kathuria made very specific slides and very specific indications of how tobacco is affecting each of the SDGs and SDG goals. And, but research is not available on all those. And in order to influence policy makers and create a public debate, we require research results. And in fact, we can go in the new direction, but nobody has thought of. For example, SDG 14, life underwater. Nobody has thought about it. But I remember reading some reports, maybe just anecdotes, that when cigarette butts, they all many of them get into sea and water. And when they get into water and get ingested by marine life, it affects marine life. So tobacco in that way affects life underwater also. And it's a topic that is not recognized at all. So there are many, many topics that are researchable, and the research on them will advance tobacco control much further. Like it has done so far, we have come a long way during last 50, 60 years with a lot of research on tobacco control. So I think I will just stop here and give it back to Sonu, Goel, and Rajiv. Thank you all very much.
Thank you, Dr. Gupta ji, for explaining journey of research in tobacco control in our country. In addition to few researches which you mentioned, I very lovingly, I also remember your comparison of BD smoking, then people often used to say BD herbal hota hai, BD is not harmful. When you compared in your study, Mumbai cohort study, I think in my every presentation I quote that study that BD is not only very harmful, but it's more harmful. Where when you compare that for every 100 cigarette smoker deaths, there are 170 BD smokers death. So I think that has clearly that study alleged every kind of concern people had at that time. So thank you very much, sir. As many of you are also aware, Dr. Gupta ji is also author of Tobacco Report in India, along with Dr. Kesharnath Reddy ji, and which has almost every information and many other such work in tobacco control is available. If our colleagues today on this webinar, they want to consult. Yes, sir, it is very important, and often we discuss with you. We need to identify themes related to tobacco control, because our politicians, our policymakers, our administrators, they are more interested what is from India. When we talk about the researches from other countries, they ask, please tell me about India, please tell me about my state, please tell me about my district. So this is something which they always ask. So I think involvement of academic institutions and e-resource center like Dr. Goyal and many other institutions who are now taking part in tobacco control, premier institution, now many All India Institute of Medical Sciences, PGIMER Chandigarh is doing a lot of work, JPMR Pondicherry. So they are training people to identify research themes in tobacco control. They are giving theses, they are identifying they are also supporting neighboring states. For example, Dr. Goyal is supporting state of Himachal Pradesh, Punjab, state of Haryana, Chandigarh, in doing a small work to give them information related to tobacco issues. So thank you very much, sir. And again, I would like to hand it over to you to sum up this session, this plenary session. Thank you, sir.
Thank you very much. I think, we had a very productive session. I already referred, for example, to very extensive presentation by Dr. Sunila Garg that she covered all aspects of SDGs. And then I particularly liked Dr. Prachi Kathuria's presentation because, she gave very systematically and a lot of work that went into connecting tobacco control with each of the SDGs and even targets SDGs. So that was a very interesting presentation. And Dr. Rana, of course, is always, his presentations and his conversation and his summation and his remarks are always very much in depth and very relevant and very much in depth. And Dr. Rakesh Gupta, always comes up with specific argument, specific findings about cessation. And in this particular session, he has come up, I think everybody has recognized that how cessation is also very important for attaining SDGs. And I think that's a very important, very interesting contribution that he has made, a lot of thinking that has gone into it. And we should all give it more thinking for cessation, which is very doable and which will have immediate effect in terms of health benefits. So have I forgotten anybody, Dr. Rana?
I think Dr. Gopal Chauhan has also
he
started
yeah, of course. I mean, Dr. Gopal Chauhan, as I already said, his work in tobacco control, his thinking, and he gave a international perspective on SDGs. I think that was very instructive, very illustrative. And his own work, of course, in tobacco control is quite laudable. So I think we thank all the speakers in this session and my co-chair, of course, Dr. Rana. And I think we are getting over time. So I think I hand it back over to Rajiv and Sono.
So thank you, Dr. P.C. Gupta and Dr. Rana for chairing the session. And actually, many won't be knowing that it was because of Dr. P.C. Gupta and his research that World Conference on Smoking or Health it was renamed as World Conference on Tobacco or Health. So it is only because of the researchers like him that the advocacy has been very good regarding tobacco control with the policymakers. So thank you, sir. Thank you also for summing up the session. Thank you. So Dr. Sono, now you can invite formally for the NC2H.
Right. So thank you all guest of honor, speakers, panelists. So especially Dr. PC Gupta and Dr. Rana, who have chaired the session so well. And I think I was not expecting so much of things are in SDGs. I was thinking on one issue on tobacco-free time, but considering the quantum of things which are required, so I think there are more than one issue which is required for the tobacco-free times related to SDG and tobacco. So really well done. I think all the speakers have done a wonderful job and nicely summarized the session. So I think now, as I said in my inaugural presentation, that our fifth conference on tobacco or health is also focusing on SDGs. It is also focusing on multi-sectoral engagement. So that is the theme of our conference, and I would like to invite through this small video every one of you to register for that conference and give maybe register in this important conference in which you will find multiple speakers. I think 80 plus speakers you will have in this. Lot of parallel sessions will be there, symposia will be there, pre-conference workshop will be there. So we'll have a short video. So Rajiv, can you display the short video?
Hello everyone, I am Dr. Sono, Organizing Secretary of 5th National Conference on Tobacco or Health. I want to invite you to this wonderful national conference, which is hosted this time by Department of Community Medicine and School of Public Health, PGI Chandigarh. As all of you know, that Chandigarh is a union territory located in northern India, and it is also known as City Beautiful. It's built by French architect Le Corbusier, and also a place of eminence when you visit different places in the city like Rose Garden, Rock Garden, and many other places including Sukna Lake. You can watch Shivalik Hills, which is very nearby, and Shimla is just 3 to 4 hours from here.
Good morning. I am Dr. Amarjeet Singh, Professor and Head, Department of Community Medicine and School of Public Health, PGI Chandigarh, India. So hereby I am inviting all of you to join in next year, 25th to 27th September 2021, for 5th National Conference of Tobacco or Health. And this is a unique event because we utilize this opportunity of Corona to do it in a unique way. This year, on these dates, we are having a curtain raiser. That is again 25th to 27th September. Next year will be the full conference. So all of you are invited to join this unique venture and led by Dr. Sono Goel and team. Thank you.
On tobacco control, and all the leaders working in tobacco control will be there at this conference, and you will have the advantage of meeting all the people and seeing what they are doing in tobacco control.
I consider that the conferences are the events not only to meet with your colleagues and participate in the academic activities, these are also to learn from your mentors and to share your work. I consider therefore that conference are the activities which make you effective to be able to make a difference.
Hi, I'm Dr. Rakesh Gupta. I'm Director of Resources Punjab. I've worked in tobacco control for almost 8 years, earlier as State Program Officer NTCP and then as Deputy Director NCDs. All the policymakers, the civil society members, the implementers, the public health specialists and the students, they will gain a lot because the aim is to attain health by tobacco control and attain SDGs. Thank you.
Hello everyone. As you all know, the 5th National Conference on Tobacco or Health is happening on 25th to 27th September this year in PGIMER Chandigarh. And I'm really excited and I'm looking forward to attend it.
Department of Community Medicine and School of Public Health is hosting the 5th National Conference on Tobacco or Health in Chandigarh on 25th to 27th September. So we look forward to welcome you all for this conference.
I welcome you all to the 5th National Conference on Tobacco or Health that is taking place in PGI Chandigarh in September. The conference promises to be a very engaging and interactive event, and I request everyone across the country to participate enthusiastically and spread the word. See you all in Chandigarh in September.
Hello everyone, I'm Dr. Gurmandeep Singh. I'm working as a state consultant for National Tobacco Control Program in the state of Punjab. PGI is organizing National Conference on Tobacco and Health in the month of September. It is one of the largest fora on tobacco control. I urge all the policymakers, implementers, activists, NGOs, even the public health students,
25 to 27 September 2021. I request all the people from across the country, from various educational institutions, NGOs, CSOs, development organizations, to register for this conference and visit this beautiful city, which is known into the entire world and existing on the global map. I also request people from across the world to register for this conference. We welcome all of you at Chandigarh.
So, right, I think, so thank you all for patient listening for this. So again, I invite all of you who are here, and we already have registration open till 15th of this month. And the abstract has been closed. I think today is the last date when the abstract will be closed. So, so you are, if you have something interesting, so you can submit it today, or you can register this, and you can publicize this on your social media as well. So now I think it is towards the end of this particular event. I'm really happy with the things which went across. I think we have many sessions, so which are very pertinent when we are talking about tobacco control. And this time we talked about sustainable development goals. And I think this is the right time for researchers who want to do some research. So I urge them to do research, keeping in mind SDGs if they are thinking of tobacco control. I urge all the, I think, civil society advocates, I can see many here, so they can put, whenever they are writing proposals or when they are pitching the things, so always pitch tobacco control from the perspective of sustainable development goals. So I think, again, developmental sector, this is really important. So before vote of thanks, I would like to invite, I think, Dr. Ashok Bhardwaj, who is the chairman of National Task Force for National Tuberculosis Elimination Program, to say a few words how we can integrate, because he has recently been appointed as the chairman, and the honorary health minister has accorded him that thing. So I think I'd like to invite him to say a few words how we can integrate tobacco control in the TB program. Yes, sir.
Thank you, Dr. Sono. Am I audible?
Yes, sir.
So it was a wonderful experience for it, because I made it a point that I should attend this webinar, It was so informative, starting with Dr. Sunila Garg, our National President of Indian Social Preventive Association. She dealt in details. So Dr. Rana is always the international lead in taking the country towards tobacco-free initiative, and hope we are moving towards tobacco endgame. So as you told previously also, so TV and tobacco, they are just like husband and wife. So if we are able to tackle tobacco, we will say that we will be able to tackle tuberculosis also. So it is my mandate that as the National Task Force Chairman and National Tuberculosis Elimination Program for all medical college, all 600 odd medical colleges in the country, I will try my level best that each medical college have a CME on TV tobacco integration, so that they also so that this message go to the state, and the state health department in those respective states can think of tobacco free state. So as I say, in my state, in Himachal Pradesh, Dr. Gopal Chauhan is doing a great work. So we are also having a CME on TV tobacco on the 29th of this September in the conference, which Dr. Sono will also be a speaker. So it is my request to all, because we should all work together as a team, so that we can think of, or we can take India towards TV tobacco free country. So Dr. Sonu, I assure you all support, and you are the lead along with Dr. Rana is the lead for the world as well as country. You are the lead in the country as well as, but more focused on northern part of our country. So I assure you wholehearted support, and whatever you will require, we will provide you from the National Task Force on National TV Elimination Program. So thank you for giving me a chance. Thank you, Dr. Gol. Thank you for doing a commendable job for tobacco-free nation as well as tobacco-free Northern India. Thank you.
So thank you, sir. I think these words speaks a lot. So if we can perlocate this message to all these 600 plus medical colleges, it will be really a commendable task. You had already been supportive in many other activities, and I think we have young colleagues of IAPSM, Indian Association of Preventive and Social Medicine. I can see Dr. Pradeep as well. So I think they are I think the young pillars of tobacco, of our association. And through this association, I think we should be able to perlocate this message to all our public health fraternity as well.
Dr. Sono, it is one of my requests.
Yes, sir.
Because I've got a friend, you also know him, Dr. Rampal Vasisht.
Yes, sir. So
he was instrumental in declaring Delhi as tobacco-free state. So yes, if you think he can be of any help, he will support you a lot.
Thank you, sir.
He was here in Mohalli for 3-4 months, and he gone to Delhi. But he will be a great support if ever you require his services. He is a master. He is a master of tobacco control, tobacco free Delhi. He started this initiative with this global initiative.
Right.
So
right,
if required, he will be of help.
Thank you very much, sir. Thank you very much, sir. I think the blend of experience of Dr. Ashok Bharadwaj and a blend of youngsters like I think Pradeep and many others. I think I must acknowledge Vikrant also, who had been doing a wonderful job in Delhi as far as dental thing is concerned. So he has already been has incorporated cessation as in the dental institutes across country. So Dr. Vikrant, are you with us? I think yeah. So maybe I think, if he's not here, so maybe we can further proceed with the further proceeding. So what I'll do is, we will have the recommendations. We'll make the recommendations, and we'll be sending those recommendations to our all our participants. And there was a suggestion of there were few suggestions and questions. Because of time constraint, we are not able to take those. But yes, we'll respond them individually to them. So thank you very much. So over to Rajiv for vote of thanks.
Thank you, sir. Thank you for this wonderful panel discussion and very informative presentations. And thanks for giving this opportunity to propose vote of thanks. So we express our heartfelt gratitude to Dr. P.C. Gupta, sir, Director, Health Karya Institute for Public Health, Navi Mumbai, Dr. Meera Biagi, ma'am, behavioral science communication expert, Dr. Jadeesh Kormam, ma'am, a regional advisor, Tobacco Free Initiative WHO CRO office, and Dr. Rana J. Singh, sir, Deputy Regional Director, NCD and Tobacco Control, the Union Southeast Asia Office, New Delhi, for accepting our request to be a guest of honors for this important national webinar on sustainable development goals and tobacco control, hosted by Resource Center for Tobacco Control, Department of Community Medicine, School of Public Health, PGI Chandigarh, in collaboration with Strategic Institute for Health, Public Health and Research and the Union Southeast Asia Office. So thank you. A special thanks to Dr. Sunila Garg, ma'am, for being a keynote speaker for the webinar. And I extend my special thanks to our panelists, Dr. L. Swasti Charan, sir, Dr. Gopal Chauhan, Ms. Prachi Kutharia, Dr. Rakesh Gupta, sir, who agreed to be a part of this discussion on very short notice. Your deemed presence has facilitated the discussion to achieve its desired goal and objective. And also thanks to all the participants for showing their keen interest in this event, without which this for. Lastly, I want to thank my entire team, organizing team, for success of this event. So thank you all. Thank you for joining today. And the announcement is like, if you not fill the feedback form, please fill the feedback form, because on basis of that only we provide the participation certificate to all the participants. Thank you. Thanks a lot.
So thank you again. Thank you all of you for joining this national consultation or webinar. So we will keep on posting you with good, interesting things in our subsequent webinars and session like this. So thank you all of you.
Thank you. Thank you very much.